Good afternoon, and thanks, Lisa, for that introduction. Um, right quick before we get started, I just want to check our audio, make sure we're good. Good. Bear with us just a moment. Okay, so real quick, before we get started, I just want to kind of briefly introduce my operative IQ team here at Clayton County Fire. Of course, as Lisa said, my name is Tim Sweat. I serve as the Assistant Fire Chief and Chief Financial Officer for Clayton County Fire and Emergency Services. Been with the county 21 years. I've been in the fire service right at 31 years. My right-hand man who kind of assists me and pretty much heads up everything we know as operative IQ is Nick Farrell, who serves as our captain in logistics. Then, of course, none of this could be done without my IT manager, who is also a certified firefighter, Robert Kershaw.
I think you can let whoever's showing the webcam ask them to turn that off because that's what the audience is currently seeing.
All right, so I got a little side note that Lisa just said. Evidently, we have some people that are showing their webcams. If you are doing that, could you please refrain from doing so? It's causing issues on our end with the audio feed. So I'll give just a quick few seconds to get those turned off, and then we'll progress forward. Okay, so once again, last and definitely not least was Robert Kershaw, who serves as our IT manager and who is also a Georgia certified firefighter. Robert manages everything IT related for our entire department, but also assists Captain Farrell in the daily operations of Operative IQ and how we utilize it here at our department. So real quick, I'm gonna give my contact information up front since we are kind of ending the presentation with a live feed of our supply rooms. So once again, you see my name. My email is tim.sweat@claytoncountyga.gov. You can reach me at 770-472-8019. And then, of course, feel free to visit our website and learn more about our organization at www.ccfes.org. Real quick, we'll go through our agenda. So we're going to start off with some agency background information on our department. Then move into some statistics for the last 20 years, which I got a pretty impressive slide that kind of shows our call volume for the last 20 years, which is kind of impressive in itself when you look at it. Then we'll look at some inventory management best practices, and then kind of a special piece on bids and proposals for those public safety partners out there who may be listening in. We'll just kind of go through some bids and proposals and how we write those here at the county to basically assist us with inventory management control, as well as ensuring that our vendors kind of interface with Operative IQ as well. So that's a kind of a special piece that I inserted in, which I think is going to be very helpful to some of you. Then we'll move into 7 useful tips for inventory management utilizing the back office. Then look at the check sheets, some advantages and your benefits. And then look at some of our check sheets and how we use them internally. And then, of course, end with a live presentation from our stockroom. And then once again, followed up with a live Q&A. And like Lisa alluded to, we have an hour benchmark for the presentation, but if we go over a little bit, I've kind of adjusted my schedule accordingly. So we want to make sure we answer all the questions that you may have. And so feel free to please post those questions so we can get to those at the end of the presentation. So some background information. Our fire department was established on March 1st of 1967. Our EMS division was established in December of 1974. We are an all hazards response agency, which encompasses fire, emergency medical services, as well as EMA, our emergency management agency services. We hold a Class 1 ISO rating, and we are currently accredited to the Commission on Fire Accreditation International as of July 2017. We currently have 14 fire stations. Station 15 is currently under construction with a projected open date of mid next year. We currently employ 411 personnel consisting of firefighters, EMTs, paramedics, nurse practitioners, an emergency services physician, and a civilian. I feel we're kind of unique, and our nurse practitioners and our physician are full-time employees with the fire department and the county. Our MPs work 24 on and 48 off alongside of our normal firefighting personnel. And then our medical director, who also serves as the emergency services physician for the county as a whole, is also a full-time employee. Our emergency response deployment, we currently run 10 engines, 5 ladder trucks, 2 quick attack pumpers, 14 ALS ambulances, 3 community treatments, which of course are staffed with a critical care paramedic, lieutenant, and a nurse practitioner, 2 boats, and a heavy rescue unit, which is kind of referred to here in the state of Georgia as the Georgia Search and Rescue Team. And we cover a 144 square mile response jurisdiction. So a very small county, if you will, however, heavily populated. During normal Monday through Friday, 8 to 5, we swell to almost about 500,000 people that come in and out of our county on a daily basis, where our normal population, as far as residents in a whole, is right around 300,000. So that doubles up to almost a million or 500,000 during the normal rush hours of 8 to 5. We've been an Operative IQ customer since 2011, as Elise alluded to. Prior to Operative IQ, our department was utilizing multiple software packages to manage our logistical and daily operations. We're one of the first fire-based EMS services to implement Operative IQ. Some of the growing pains that we initially went through were that of Operative IQ was originally designed to accommodate public and private EMS, not so much fire-based EMS or fire departments as a whole. Initially, when it came to license, we bought station license versus vehicle license, which were extremely hard to manage in order to track those items all the way down to the vehicle level, like we wanted to do, whether it be assets or just general operating supplies. We transitioned from station license to vehicle license. I think we're currently up to about 49 or 50 licenses for our department, and that basically covers every single emergency response vehicle that operates in the field on a 24-hour, 7-day-a-week basis. Another growing pain was changing the mindset and the operations and the daily routine of a fire-based EMS service. For those departments who may be out there listening that are fire-based, firemen are they don't like change very well, and they sometimes resist it. So one of our big challenges was changing their mindset to get them to a more electronic-based platform for doing things at the station level versus the old traditional check sheets, which were printed out and filled out with pen and paper. This is a slide I alluded to earlier. Just shows you our call volume over the last 20 years. So in 1999, we ran roughly 16,827 calls. And right now, we are on projected to run on calendar year 2019, 44,892. So to say we have grown is an understatement. We continue to show roughly between a 3.5% and 5% call volume increase every single fiscal year. So we must, we're always asked to do more with less. So as this slide shows, call volume is steadily ticking up. It is not going down for sure. So this graph kind of shows our EMS side of the house and currently where we're at. So back from 2013 up to 2018, it shows you the number of calls for a calendar year, then the percent of those calls, or the number of those calls which were EMS calls, and the percent of total calls which were EMS based, and the number of transports. I look at this very often because a lot of this, the majority of our Operative IQ system when it comes to soft supplies are all EMS driven. So as you can see on this slide as well, from 2013 compared to 2018, our number of transports and our call volume are steadily increasing. And then the bottom currently shows, as of July 31 of this calendar year, we've ran 26,263 calls. Of those, 24,401 were EMS based, or 77.68% of that. And we've already transported a little over 11,000 patients this year. So let's jump into inventory management. So inventory or stock is the good materials that a business holds for the ultimate goal of resale, or some of in our case, not resale, but the issuance are to be used in the field to treat our patients or citizens, or however you see it. Inventory management is a discipline primarily about specifying the shape and placement of stock goods. It is required at different locations within a facility or within many locations of a supply network to proceed the regular and planned course of production of stock materials. So if you'll notice, I highlighted many locations of a supply network. Here at Clayton, we're kind of unique in the fact that we run one central warehouse for everything EMS related. We do not have satellite warehouses in the field. We don't field from the stations. We have one central location here in the county, which benefit for us. It's adjacent to our main transport hospital. So 9 times out of 10, when our trucks get through transporting, and in the event they need to resupply, the warehouse is geographically located right beside our main transport hospital. So while your products are the primary source of sales and revenue, they can also tie up a lot of cash in your business if your business isn't using a proper inventory management system. Inventory takes up warehouse space, requires handling, will spoil or go out of style, and unfortunately be lost or even stolen. So it's a proven fact through research right now that over 43% of small business owners in the US still use pen and paper or spreadsheets to track inventory or don't track inventory at all. Thanks to us, we have operative IQ, so we're not included in that 43%. So some best practices regarding inventory management. Know what type of inventory management fits your business. OpIQ goes beyond standard warehouse inventory management software by continuing to track inventory in the field, which I alluded to back prior to operative IQ. The software we had in place pretty much was just warehouse-based software that tracked what we had on hand, but once it left the warehouse, we lost all of that valued information that comes with when it's actually used in the field, or if it's a medication when it's actually administered to a patient. So Operative IQ is unique in a way that it continues to help you track that supply, not only from the supply room, but all the way out into the field and ultimately to when it's actually used on a patient. Your operations management software provides you with complete visibility across a distributed supply chain. So make your cycles count. So cycle counting frequency. I got a question. How many cycle counts do you perform on an annual basis? If you can honestly answer that and you say 1, I would say maybe you need to go back and reconsider that. We have a standing order in our operations. Every 90 days, we cycle count our entire supply room just to ensure that our on-hand inventory is accurate. And why that's important to me from a financial standpoint is to ensure that when we place those orders, that our on-hand quantities are correct, so our future orders dictate what is actually needed. If those cycle countings are not done frequently and your shelf counts are off, then of course your replacement orders are going to be incorrect. So what is your counting strategy? Do you divide the inventory room out and do it by locations, or do you do it by category or items or value? It's totally up to you. We do it kind of different ways. Sometimes we'll do just one side of our supply room, or we'll do a section, whether it be airway or medications or stuff like that. Our value, we really don't use that format, but feel free to break it out in a strategy that suits your operation best. And last but not least, who's in charge of your cycle counting? This to me is a very valuable question that you really need to ask yourself. Do you have a trusted employee that will be responsible for running a tight cycle count system? As bad as I hate to say it, can you trust that employee to do that and to ensure that the count A is accurate, but B, he's putting accurate data into the system? So manage your inventory. Of course, we all know first in, first out. Make sure you have par levels set. Implement a good quality control program. So do you have signs of damage on your supplies? Do you have leaks, tears, or broken seals on your medications? Prices and terms of sale. How are your bids proposals written in regards to expiration dates? So example on the next slide. This is where I'm going to get into how we write our bids and proposals here at the county to ensure that it kind of falls in line with our inventory management goals and strategies. Prepare now. As you plan your business, be sure to keep inventory management as an important topic of discussion or conversation. Operative IQ offers an easy-to-use system which virtually eliminates human error that many manual data tracking causes. So here's a quick snapshot of one of our scope of services on one of our bids. I'm not going to read through this whole thing, but the things I have highlighted in red are certain things that we put in. So for instance, number 1, our medical supplies, once they are ordered, they're due to arrive at our location within 5 business days. That's written into our bid. Number 2, all the items shipped must have a shelf life no less than 20 months from the date of purchase. This is important when it comes to medications to ensure that the medications you receive, in our case, have at least a 20-month shelf life left on them. Number 3, the bidder shall include a written process of bidders' recall procedures. including issuance of credit and/or replacement of all recalled items. Once again, going back to inventory control and management with Operative IQ, when we receive our medications in, we track expiration dates and the lot numbers. So in the event we do have a recall on a certain item, it's very easily can be identified through the software. Number 4, the county may, in its opinion, delete. No, that's okay. Let's move down to number 6. Bidders shall not require minimum order quantities of any times. A lot of your vendors, if you don't place this in here, they'll require a minimum quantity when you place an order, and sometimes that can be costly. You know, if you only need 5 of something, why do you want to order 15? So just once again, a couple of things we put into our scope of services on our bids before they go out. The next ones are some minimum requirements. The first one, bidder shall comply with all Food and Drug Administration standards as applicable. Second, which is a biggie to me, bidder shall have the ability to interact with inventory management system Operative IQ. We actually write this into our bid, which eliminates a lot of vendors from actually being able to bid on our supplies because they simply can't interact or communicate with Operative IQ. Number 4, prices shall not increase during the initial terms of the agreement. All of our pricing is locked in for 12 months once the bid is actually awarded. And then at the end of the 12-month period, the vendor has the opportunity to solicit for a price increase, and then we approve it or deny it. But initially, all of our pricing is locked in for 12 months solid and cannot be raised. Then at number 5, all pricing shall include shipping and handling fees. That's very important as well, because what we've been able to do with Operative IQ in our department is we basically now place 3 EMS orders a year, basically once every 4 months. So we do a July order, and when we transition to our live feed and come in the supply room, you'll see a whole lot of overstock sitting behind our stock shelves because our main supply order for the next 4 months has pretty much now all come in. But we order in July, November, and April. Those are the only 3 orders that we do on a fiscal year. Of course, we're government-based department, so we operate all fiscal year from July 1 through June 30th. But Operative IQ has allowed us the opportunity to, through forecasting and looking at historical data, the ability to basically order every 3 months. They're around large orders. They run between $65,000 and $80,000 an order, depending upon the season. As we all know, with changes in seasons, different medications and supplies are needed, whether it be the winter months and colder or the hot months. But once again, make sure your proposals or your bids includes all the shipping and handling fees. So once again, set your par levels, minimum amount of product that must be on hand at all times. Constantly monitor par levels to adjust second items, seasonal items, i.e. your nabs, your butyrols. Of course, first in, first out. Manage your relationships. Develop strong relationships with your vendors for those times when favors are needed. You know, we all run out of things now and then, and with that strong relationship with that vendor, if you can have it shipped overnight or ship and build if they require a PO system, just make sure you develop those strong relationships. Contingency planning: when your call volume spikes and inventory runs low, what's your plan? If you don't have enough room in your warehouse to stock seasonal supplies, what's your order frequency? And then the big one for us is, what if the vendor runs out of a needed product? What are you going to do then? Regular auditing, cycle counting, subcategory, PO receiving policies and procedures, your annual inventory every year, basically just going through the entire stock room every year and making sure everything is up to date. This is kind of different from cycle counting, but kind of similar in some aspects as well. Prioritize with ABC high value products with a low frequency of issuance, such as like calcium chloride. Moderate value product with a moderate frequency of issue, then low value products with a high frequency of issuance. So once again, just prioritize with those. Certain products need more attention than others. Accurate forecasting. Look at your trends in your call volume. Last year's call volume during same ordering time, your seasonal items, and of course, reports. So Operative IQ's check sheet provides an easy, intuitive, flexible method to collect and tally data in real time. So the question must be asked: how effective is your check sheets? If you're using paper check sheets, you know the hassle of digging through your file cabinets or binders for important information. You lack the ability to easily report on trends or pinpoint issues needing attention. Accountability is less than desirable, as paper checks provide no real-time data. They can be illegible and even get misplaced or lost in the shuffle. CCFES has been able to completely eliminate all paper check sheets by implementing and fully utilizing Operative IQ's check sheets. So real-time inventory, accurate inspection data, and link requests to supply replenishment or equipment repair. With this end-to-end functionality, you can order effectively to keep supply rooms stocked automatically and send notifications to supervisors and stay on top of vehicle maintenance needs. So asset accountability, you'll minimize risk exposure by allowing crews to complete and document equipment inspections and verify assets in the field. Two-way communication allows for a service ticket to be created and handled with ease. Check sheets are simple to use, easy to build, and are designed to run on all mobile devices. So advantages of the check sheets: capture overall status and movement at your supplies and assets, two-way messaging on fleet tickets and flexible internal tickets. Supply requests are replenished easily while reducing reserve stock levels. Live vehicle record updates and alerts when fleet maintenance is due. Collected data contributes to overall management of operational needs. Communicate critical issues in real time for prompt handling. So the benefits of the check sheet: minimize errors, reduce time to complete inspections by up to 50%. Chain of custody tracking improves accountability. Multiple crew perform inventory and inspection sheets on separate devices, which we're going to actually show you that during the live presentation. Supervisors are alerted of issues, captured on the check sheet immediately, and you know which assets are on which vehicle and that they are operational. So this is just a quick glimpse of one of our asset verification records, how we utilize asset verification. This is completed every morning at shift change, which is at 07 a.m. for us. Just a quick look at our asset verification. And then our inspections are, as we like to call them, questionnaires. All of these options here have taken their place of a paper check sheet or some other based reporting system, whether it be email or an Excel file. So all of the inspections or questions that we have at the station level are all completed via the check sheet in Operative IQ. And of course, the two at the bottom are grayed out. Those only populate when they're actually due on the date of the month. Then, of course, our inventory, same way, our fire apparatus equipment, our station supplies, BLS unit inventory, and then our fleet cabinets.